Around 2015, I started to see some blemishes on my skin. So I started to go to dermatologists because I thought, it was a skin thing. And they would diagnose me with eczema, psoriasis, severe psoriasis, severe eczema, like everything but, anything cancer related. They also did not do any biopsies of any sort.
My story started in 2008. Started seeing a rash on my skin, itching, but through the years, the itching got worse. And after going through dermatologists, it's nothing. I went from lichen planus to eczema to acute eczema. And nothing was working. All the scripts, the prescriptions they gave me, the ointments, I went through light treatment. Everything that had to do with eczema, I went through it. I started swelling up. My hands, my whole body was swollen and itching, burning. And whenever I would go to the doctors, it's like, it's eczema. Finally went back to my primary care doctor. I need help. Please help me. Took me 15 years, almost, to get to my diagnosis.
Years ago, my dad had a transplant surgery, and in that surgery, he had it at a hospital in New York City. And I knew they would have specialists. So the head of the department, even though they didn't know what it was, they both decided that it'd be smart to do a biopsy. She started to read all of these terms. When she got to the word cancer, it was like, what? Cancer? And that's how I found out. So all the way from 2015 to 2019, I was unaware of what I was dealing with, and I was diagnosed the whole time.
Yeah, I think it's a multi-layered issue when you're talking about patients of color and or people from other countries attempting to get to the right people, to get a right diagnosis, to be understood. I think that there are multiple layers, right? And there's a lot of obstacles that they face, even getting to the right practitioner. Dr. Linhares, feel free to jump in.
Yes, absolutely. There is a range of issues that come up in caring for people of color. So starting with just disease itself, the manifestations of disease may be a bit different in darker colored skin, such as, for example, with cutaneous T-cell lymphoma, hyperpigmentation, so skin darkening is actually pretty rare in patients with paler skin color or lighter skin color, but actually is very common, almost up to 50% in patients of color. And then additionally, the differential diagnosis for this hyperpigmented darker lesions is different in patients of color versus those that have less pigmented skin. So we can be dealing with access to care and just being able to get to the provider. The cutaneous T-cell lymphoma is already a very rare disease. Additionally, few oncologists understand it, and even fewer actually want to specialize in this disease and actively pursue care of these patients. So I would say in general, it's hard to find a provider that is adequately educated in CTCL and is actually willing to dedicate themselves to this patient, because really the CTCL journey is the journey of the patient and the healthcare provider together, because it's a journey of many years. And that's the beauty of it, really, is each patient is unique. And the provider has to be in sync with the patient. The provider has to be consistent. Provider has to learn and understand their body. So this continuity of care, years of care together, is very important.
When you end up having hypopigmented disease, which leaves the white marks on a darker colored skin, can be pretty traumatizing for folks to have to deal with the stigma of that, even if the disease itself is manageable, even though it's chronic and it may not be life-threatening, but the impact of someone's life and quality of life because of how it presents can have a devastating effect.
I stopped working in the days. I took night jobs because I didn't want anyone to see my skin like that or for me itching. And it got so bad that when I did get diagnosed, I asked my oncologist, could you give me something for the itching? And he looked me dead in the eye and he said to me, Ms. Bukal, of all these years that you're getting prescription, did it ever work? And I said, no. Okay. So we're going to the problem, the root of the problem. And it was so comforting to hear that, okay, you got this diagnosis, now there's a treatment plan for you.